Good evening and thank you for keeping it TV 47. You are just in time for Body Garage with I, Sheila Chelangat. Now this March, the world would be marking the World Kidney Day, a day that is set aside to raise awareness on the importance of the kidney as well as some of the kidney diseases that are present. With me is Dr Hussein Bagha from the MP Shah Hospital. Habari sana daktari.
Nzuri, thank you very much for having me.
Yes, could you first introduce yourself to my viewer?
Okay, so as you mentioned my name, Dr Hussein Bagha. I'm a consultant physician and a nephrologist, which means a kidney specialist, working at the MP Shah Hospital here in Nairobi, Kenya. I head the kidney or the renal unit as well as the kidney transplant unit here at the MP Shah Hospital.
Now this day that is set aside for World Kidney Day is to raise awareness on the importance of the kidney. How important is it in our bodies, and first, where is it even located?
So the kidney is basically, every normal person is born with two kidneys, and they're normally located in the back, which is here. Not here as everybody assumes, they're not in the front. They're normally located in the back. They're very, very important organs in the body because they help to regulate your water balance in the body. They remove the excess water and they conserve water when there is lack of water in the body. They help to control your blood pressure as well. They help to remove excess waste from the body, the toxins that build up in the body. They are very important in terms of regulating your electrolytes like your potassium, your calcium, your sodium, magnesium. They're also very important in producing hormones like vitamin D, which is very important in the body, and also another hormone called erythropoietin, which helps to regulate your blood levels.
Okay, if you could go further, Daktari, on the components of the kidney, because most of us know it's just bean-shaped. What are some of the components of the kidney and their importance?
Okay, so when you look at the kidney basically has got a blood supply, which basically brings the blood into the kidney, and then there's another blood vessel called the renal vein, which removes the blood from the kidney. Then we have a component, a pipe which is attached to the kidney, which is called the ureter, which now passes the urine which is made in the kidney to the bladder. So within the kidney itself, we have three components. One is called the glomerulus. So just to start off, within the kidney itself, we have the units of the kidney we call the nephrons, and every kidney has millions of nephrons. And these are all synthesized at birth. And each nephron is composed of a glomerulus, and then we have the tubules, and then we have the collecting ducts where the urine accumulates. Within all of that, we also have, of course, our blood vessels and the connective tissue disease we call the interstitium, which basically holds everything together. So that's in a nutshell the kidney.
All right, Daktari. And how different is the kidney system from the urinary tract system?
So the kidneys are part of the urinary tract. So the kidneys are integral in forming urine, and then the urine then flows through the ureters, and it is stored in the bladder until the bladder gets full, and then you void it via the urethra. So the kidneys, ureters, bladder, and the urethra form the urinary tract system. So the kidneys are part of the urinary tract system. Yeah.
Today, Daktari, we are focusing on kidney infections. What is a kidney infection, and how does it come about? What causes it?
So a kidney infection means that you get an infection in the kidney itself. It is quite a serious complication, and normally more than 90% of the time the infection basically comes from the urine. So if you get a urinary tract infection, like let's say in the bladder, and it is not treated well, then the infection can ascend upwards into the kidney. Sometimes you do have complications of the urinary tract where you have blockages either because of a stone, or in males when they're more than 50, the prostate sometimes tends to get enlarged and causes blockages, and that can predispose you to getting urinary tract infections, and these can basically ascend upwards, especially if it's not treated well. Another cause of kidney infections is, source of kidney infections is basically if you get an infection in the blood. Remember I told you that there is a blood vessel called the renal artery that supplies blood to the kidney. So you can get these infections coming from the bloodstream as well. So those two are the most common sources of infections. Sometimes you do procedures on the kidney, like a kidney biopsy, and you can introduce the infection directly into the kidney, but those are a bit rare. Yeah.
Okay, you're saying that sometimes it's from a urinary tract infection. Is it that now it causes the kidney infection because the UTI was not treated?
Yes. So if it's not treated well, and if there is an obstruction, like I mentioned, then it will be difficult for the infection to be eradicated completely. So then what happens is the infection will then spread upwards. It is called, it will ascend to the kidneys and subsequently cause an infection within the kidneys.
And how common are these kidney infections, especially here in Kenya, Doctor?
So we tend to see quite a bit of infections in the kidney. We call them pyelonephritis. That is a medical terminology that we tend to use. It is more common in somebody who gets recurrent urinary tract infections, which are not treated well. It's also common in patients who have got abnormalities of the urinary tract. As I mentioned, sometimes you can get blockages within the urinary tract, either because of a stone or a stricture, which is narrowing of the ureters or the urethra, or if your prostate is enlarged. So all of those will basically make it difficult to eradicate the infection. And unless if you are cognizant of that and you look for those defects, then it will be difficult to completely treat the urinary tract infection or the urine infection, and that can now subsequently ascend upwards and cause a kidney infection.
What are some of the symptoms that someone would present if they do have a kidney infection?
So most commonly, they would get pain on the flanks. Remember I said that the kidneys are on the at the back. So you'd get pain on that side, you'd get fevers, you get a lot of nausea and vomiting as well. And as I said, that if it's an ascending urinary tract infection, then you'd also get symptoms of having pain on passing urine and passing urine more frequently, and sometimes you may also see blood in the urine. But most commonly, specific to the kidney itself, you will get flank pains, you get nausea, vomiting, and very high fevers as well.
And very high fevers. And who is more at risk to getting these infections?
So as I said, anybody who has got any abnormality of the urinary tract, they're at a higher risk of getting kidney infections. Patients who get urine infections or urinary tract infections which are not treated adequately, elderly males who have got prostate problems and they're not picked up as well on time, and they get recurrent infections. So they're all at a high risk of getting these kind of infections, kidney infections. Patients whose immunities are not good, like their immunity is suppressed, like patients who are on medications which suppress the immunity, like cancer patients who are on chemotherapy, patients who are living with HIV/AIDS, patients who have autoimmune diseases and are on medications that suppress the immunity, they're all at risk of getting this kind of infections. Yeah.
And are these infections somewhat hereditary?
No, as I said, unless if you have any congenital abnormality of the kidney. Congenital means, like for example, if you are born with something abnormal and it runs in the family, like cysts in the kidney, normally it is not hereditary. Yeah.
I was reading Daktari, and it seemed like women are more at risk than men. Why is that?
So women are at more risk of getting cystitis, which is infection of the urine within the bladder itself. Now, if you look at the anatomy of the urinary tract of a female, is very different from that of a male. So for the female, the urethra is extremely short. And remember that around the exit of the urethra, where the urine comes out from, we call it the perineum, there's a lot of bacteria there. So it becomes very easy for the bacteria to reach the bladder because the urethra is very short. Unlike for males who have got a longer urethra, so it takes much longer. So because it's short, the time frame it takes for the bacteria to reach into the bladder before the female voids or passes urine, it will take a shorter period of time. So the bacteria get into the bladder, they colonize the bladder and cause an infection. So unless if a female, and one of the ways in which we try to mitigate this problem for females who get recurrent cystitis is to tell them to take a lot of water and not to hold urine for long periods of time. So every time you are peeing, you're actually flushing out the bacteria. Yeah. So I know that sometimes when you are busy in your work schedules and you're in a workplace or other places, especially if you're working in the field, you don't get access to the bathrooms as well. So then that causes a lot of problems. And some people are also shy to use public bathrooms for obvious reasons, and that can lead to recurrent infections.
So it's important to note that it's not good to hold in your pee when you feel like peeing.
Yes, because you see, every time you are peeing, you're actually flushing out the bacteria. Yeah.
All right, Dr. Hari. And now let's get to the diagnosis bit of it. How do you doctors diagnose kidney infections? What are some of the tests that you take? So, of course, once when a patient presents with the symptoms of a urinary tract infection or a kidney infection, then the first test, of course, you do is to do a urine test. The urine test is a very simple test to do. It will tell us whether there's an infection in the urine or not. Then, of course, we do the blood tests as well. We look at the markers of infection in the blood, like your white blood cell count, your C-reactive protein, and your procalcitonin. And then if you're suspecting a kidney infection, the pyelonephritis as we call it, then we have to do imaging. And the simplest one is basically an ultrasound of the kidneys, which will basically show either there is a collection of pus or there is perinephric fat stranding, which are the things that we look out for. Sometimes it can basically be normal, the imaging. And that's why you have to have a very high index of suspicion, and you need to do a very good examination as well to pick up that this patient has got an infection that has ascended to the kidneys. Yeah. And after that now, Dr. Hari, what are some of the treatment options that are available for someone who has a kidney infection?
So of course you have to start them on an antibiotic. You have to do your cultures, both urine and blood cultures, and then start them on antibiotics. If it's a simple pyelonephritis or simple infection of the kidney, it can be treated as an outpatient. Of course, you have to look at the patient individually, whether they have good social support. They will be able to come back to the hospital for a check after 48 hours to make sure that the infection is getting cleared up. However, if it's not a simple pyelonephritis and if it's more complicated, like the patient is vomiting, is not able to tolerate oral antibiotics, or if the patient is going into sepsis and septic shock, then you have to admit the patient and give them intravenous antibiotics and then monitor them while they're inpatient.
What is the risk of complications, say a kidney infection is left untreated?
So, of course, one is the fact that it can become systemic, meaning that the infection can spread into the bloodstream. Patients can get sepsis from the kidney infection and septic shock, and sometimes it can even be fatal as well. And of course, if it's picked up late, there's a lot of damage that happens within the kidney itself. Of course, we have two kidneys, but you want to preserve both of them. So once when the infection settles in the kidney and it's not treated, then it causes a lot of damage to the kidney as well, and then it heals by scarring. So that part of the kidney that is damaged will not be able to regenerate back or recover fully.
All right, thank you, Dr. Hari, for taking us through kidney infection, some of the symptoms as well as the causes. Do not go too far, as Dr. Hari in the second part will be taking us through some of the ways to prevent, kidney infections. Keep it TV 47, but first take a look at some of the myths and facts of the day. Kidney disease is caused by drinking alcohol. While excessive alcohol consumption can negatively impact kidney health, kidney disease is caused by factors like diabetes, high blood pressure, and genetic predisposition. Kidney disease is only a problem for older people. While the risk of kidney diseases increases with age, it can also affect younger people, especially those with diabetes, high blood pressure, or a family history of kidney problems. diseases are incurable. Some kidney diseases can be cured with early diagnosis and treatment.